Good afternoon, Carl Springs, and thank you for joining us again for another one of our question and answer sessions here on Facebook. I'm joined here today by Dr. Peter Antebi, our city's medical director, who's going to provide us with some information. We're going to answer any questions that you have. If you do have questions throughout the entirety of this presentation, feel free to put them in the comment section, and we will answer them to the best of our ability here today. Dr. Antebi, to start us off, would you mind please giving us an overview of COVID-19 once again? Highlight some of the symptoms that are out there, and also provide us just a general update of what we're doing in the medical community and what folks need to know today about this dangerous disease.
Absolutely. Hi, everyone. This is Peter Antebi speaking. Thanks for joining us today. I hope everyone is staying at home, hunkering down. I know it's difficult. Here you see Alex and I are in our homes as well, trying to keep everybody safe. As far as the update is concerned, as expected, COVID-19, the number of cases that we're seeing in the hospital, in the emergency departments, and just people in general who are calling us for help from the 911 side is increasing. And we knew this all along. We knew that it would happen, just like it's happening elsewhere around the world. As far as the symptoms that people should be aware of, you should all know this, but it's similar to the flu, right? You have fever, sore throat, headache, body aches. Those are really the main symptoms that you'll have, upper respiratory type symptoms. If you have those symptoms, there's no need to panic. Remember that initially you're going to feel just like any other illness. You can take some Tylenol. Remember, we told you not to take Motrin, Advil, or any ibuprofen type products, and we still are sticking to that as well. But essentially, there's no reason to panic and jump into your car and go get tested. Obviously, the younger population, meaning the children and even people kind of under the age of 20 are much lower risk. Now, you know that we've ramped up testing not only at hospitals, but the county itself now has sites that qualified people can go and get tested at. And then you've heard that the federal government is working on getting many more tests and also different kinds of testing. The test that they're looking at now is a blood test, which is very interesting for us because it'll give us more information than the current test that we're doing today. So I would encourage people to continue to stay at home, don't expose yourself to other people. And Alex, I think this is a very important piece of information, that you could be around someone who is not exhibiting any symptoms of COVID-19. They're not coughing, they have no fever, but they could still be spreading the disease. And so it's very important to kind of stay at home, don't go around other people. If you feel good and your neighbor looks like they're feeling good, I still wouldn't advise you to go visit your neighbor. So I'll stop there, Alex, and we'll see what other questions that are coming in.
Yeah, I appreciate that, Dr. Antebi. We want to provide just an overview right now of some city actions that have taken place, some county actions that have taken place, and provide our residents with a general overview of what they need to be aware of. So this past weekend, the city of Carl Springs did issue an emergency order that provided additional protections for child care facilities, our preschools, our daycares, and other facilities providing care to children under the age of 18 years old. That emergency order provides provisions for them. It requires them to take temperature testings of folks that are going to enter those facilities. It requires them to screen their staff. It requires them to provide hand sanitizing and washing for students, disinfecting of common areas, as well as some other general provisions that they need to follow. So that was something our city did this weekend for our citizens in an attempt to continue keeping our children safe and prevent the spread of this disease. Additionally, over the weekend, late yesterday afternoon, we were made aware that the county issued an order essentially stopping all non-essential businesses from operating. It provides certain exemptions and provisions for businesses that provide food, grocery, medical supply companies, medical offices, and it provides exemptions for other professional services as well. So for a complete list of businesses that are deemed non-essential and a complete list of businesses that can stay open, please visit our city's website, www.carlsprings.org. That website is a landing page. It will provide all coronavirus information right on the homepage. So go to our city's website to get a full list of those non-essential businesses. I want to address the fact that Some of our citizens were asking us yesterday why we were not pushing this information out right away. In many cases, the city of Carl Springs gets the information at the same time that the citizens do. We get updates from the county, the Department of Health, and the state during press conferences that they hold with their elected leaders. So as a city, we get that information, we analyze it, we take it, and we try to provide direction to our citizens as soon as we can possibly do that. So we do apologize for that delay. We're working as fast as we can to get those updates to you. Some other updates that the city has done, we have changed our business hours for our City Hall facility. We've rolled back our hours to include 9 to 3:30 for our one-stop shop during the week, and also 9 to 1:30 on Fridays. So those hours will be subject to change in the future as we continue to evaluate this and we continue to move forward. Also today, the governor announced closures of state parks. So something else for our residents to be aware of as we continue to move forward through this. Dr. Antevi, wanted to ask you, there's a lot of talk about a vaccine for this. There's a talk about this vaccine being developed. Can you please go over, some information that you have and some information you might be able to provide to our residents?
Sure. I think that there are companies who are working hard on a vaccination, but I think it's important to understand any vaccination, there's a process that it goes through that's currently in human trials, but the process of getting it into, let's say, your local minute clinic is a lot more difficult, and you're looking at really at a year to 18 months is really what is being told to us, even if they try to fast track it. So we're not really anticipating this season. And when I say this season, is because this virus may act in general like what the flu does, which is every season you get the flu, but it's never the same strain of the flu. We call it just a little drift. And so every year you have to go back and get the next vaccination. And so I wouldn't hang our hat, Alex, on vaccination, but what I would say is there's a couple things, is that what will come out first are medications, or a cocktail of medications, as you're hearing already, that will help fight the virus before you get to the point where you end up in the ICU on a ventilator. And I think that is the much more promising data that we're following very closely. That's number one. And then the second one is this test I mentioned earlier. The test that's coming out, being fast-tracked by the FDA, is going to help us know three things. Number one, have you been exposed to coronavirus at all? So it'll give you are you positive, are you negative? And if you haven't been exposed, then that means you're at risk. Number two, have you been exposed and you're actually actively fighting it, meaning you're actively infected with coronavirus? That'll give you that answer. And thirdly, and maybe even just as important, have you had coronavirus in the past? You may not even know that you had it, but now you have the antibodies and that you're immune to it. So it's going to give us three important answers, because if you do have the antibodies, then that means that you're not really at risk of getting it again, at least this season. So that'll be a quick, what we call a point of care blood test. The results should come back in 45 minutes. We're trying to get those down here to Florida. So I anticipate better drugs, better knowledge of those drugs, and then better testing rather than the testing we're doing today, which, as many of us understand, the turnaround time for those tests are not so quick depending on the lab that's running those tests.
Doctor, and I'm sitting here seeing a few questions coming in that are medical in nature. I'd appreciate if you could give us some direction. One of the questions I have is about whether or not this is airborne, a question from Wendy. She said she's heard from a credible source that this can be airborne for up to 3 hours. And I also have another question here from Mark asking about, Dr. Facci said that the ibuprofen story is not true and that it's fine. So if you can kind of maybe provide us a little bit of clarification on those two items, we'd greatly appreciate it.
Yes, and so when we mentioned the ibuprofen story the last time, we threw in a caveat, which was it's preliminary. We don't really know the answer as which way it's going. I've scoured the research and I've looked into the data from where that comes. And so, yes, there is no very large study at this point. Remember, this came from the French minister, and it was pushed forward, and that a lot of the patients who were getting really sick were on some type of NSAID, that category of drug. So yes, whoever made that comment, I would agree that it's not set in stone, But what I would tell you as a physician, and what I would do for my own children and my own wife, is I would say, let's use Tylenol. Because indeed, for example, there's another not a case report, another study that came out, still hasn't been peer reviewed yet, about blood type. And certain blood types are more likely to get sick, and then certain blood types are less likely to get sick. Again, you probably also heard that in the news. I looked at that study as well. Again, small sample size, and that's just another publication. So I would say here that the literature is very rapidly evolving, and we need to just continue to make sure that we're up to speed on that. Let's go back to the other question, which is aerosolization. Many people have said the word droplet precautions. I read a study this past week from China, actually looking at whether or not this is truly aerosolized or not. And they actually went into the hospital where these COVID patients were staying. They went into the bathrooms. They tested the air samples. And indeed, they did find that they found the coronavirus aerosolized, meaning kind of floating in the air. And then they say that those drops onto the surfaces. Interestingly, they say that if you're walking in a very high volume area, like a public bathroom, it could even be in the feces. The feces gets on the floor. People track over the feces, and then it aerosolizes that virus as well. And so we kind of internally, from the physician point of view, and my colleagues believe that there is an aerosolization, and what we have implemented, not just in Coral Springs Parkland Fire Department, you'll see us kind of wearing the gear that'll cover everything, but also in the hospitals, they're doing that too for patients who are requiring advanced airway or people who need help breathing and so forth. The physicians are being told to up their level of PPE to combat the aerosolization. So we're wearing goggles and masks and gloves and booties and the headgear. So if you see us coming into your home, one of our members at least will be dressed that way. We're trying to protect our membership. So we're practicing what we're preaching.
Thank you, Doctor. I appreciate that. A couple questions here about some procedural things that we'll go through. We have some questions. Is Florida going to be on a lockdown? From Angela. Wendy's asking, will the governor finally put an order to stop working? The list of essential businesses seems long. I'll once again reiterate that the city of Coral Springs gets our information at the same time that you do. Oftentimes the media gets it first. So we're trying to get information as quickly as possible from our state and county partners so that we can analyze that and provide that back. I do not have an answer at this time. If the governor is going to issue an order, I can't give that information because I just don't have it. We have a couple questions here about whether or not there's going to be a curfew. At this point in time, we do not have a curfew in the city of Coral Springs. That's something that our chief of police is continuously evaluating and evaluating the need for that. So at this point in time, the recommendation was that would not be a practical approach. So we're continuously monitoring those types of things, and if there is a need for one, or if their circumstances change as a city, we're ready to analyze that and react. We have some questions here. Are moving companies considered essential business? Under the county's order, yes, moving and storing companies are considered an essential business. And I'll reiterate, on our city's website, there is a list of different types of businesses based on our code. It is not comprehensive, so if you're not listed on our website, you can refer to the county's exemptions to get more information as well, and links are included. I have a question here. What are the number of cases at Coral Springs and Broward Health currently? So I don't know the exact number at Broward Health, Coral Springs. I do know that the Florida Department of Health issued information to the public this morning. They released a report. The city got that information at the same time as the public. It included 4 cases here in the city of Coral Springs. We were able to confirm that on a conference call today that those 4 cases are based off of the address of patients. So we don't know where those folks are. That is updated daily, and folks can go to the Florida Department of Health's website. It's floridahealthcovid19.gov, and you could find all that information, the same place that the city is getting that information. We have a couple questions here, Doctor, about, today until April 3rd is considered some critical weeks to respond to this. That's a question from Valerie. Are you able to maybe give a little bit of background into, what flattening the curve means when we talk about critical weeks and time to contain this, what that means from the medical point of view?
Absolutely. Flattening the curve just means that if you take the total number of people who are ultimately going to get sick in America, and let's just even take Coral Springs as an example, or let's just say Broward County. If the total number of people who are going to get sick all get sick very soon in the next month, then you have tens of thousands of people who need to show up at an emergency department and potentially take up an ICU bed. Obviously, we don't have tens of thousands of ICU beds or ventilators for that matter. If you flatten the curve, you take the same amount of people who are going to get sick, and instead of having them all get sick next month, you have them get sick over the next 12 months. So the hospitals are seeing, instead of that big spike in demand and need for those beds, that demand flattens, the curve flattens, and it's spread out so that those patients end up being seen in all the Broward hospitals over a longer period of time. And let me tell you, it's happening where our hospitals are seeing an uptick in the number of COVID patients in the ICU. We are seeing the number of ventilator use go up. We are making plans currently here in Broward County. We've been working on this now for some weeks now to actually accommodate for this and to make sure that we know what our status is on a day-to-day, real-time basis, because that is the one thing that is really going to be a choke point, if you will. It's if you have somebody who needs a ventilator, I'll say it this way: if there's 2 people who need a ventilator and there's only 1 left, that's going to be a problem, and that's why the federal government is scrambling. That's why private industry is scrambling. There are even some folks in Italy who have figured out a way to use 1 ventilator on 2 or 4 people, 2, 3, or 4 people. And so it seems crazy, but we're looking into every option of every single critical care bed, whether it be a surgical center. We're even looking at the ventilators that some veterinarians have, which happens to be the same ventilator that you would use on a human being. So it's a very good question, and we are surely on top of it. And we will be sure that we do as best as we can to protect the people of our cities and our county. But really, the role is of every single one of you watching, and your neighbors and your relatives. You can see that I'm here right now. No one's coming to visit, and we're not going to visit anybody else. Obviously, with my role at the fire department, it's a little bit different, but I surely am trying to stay away as much as I can, and I hope you do too.
Thank you, Doctor. And so that kind of segues into some of the questions we're getting. We are running a poll. We're asking folks, are you staying home? You can respond with either #yes or #no. And I have some questions here. Do you think that Coral Springs should order a stay-at-home order? Do you think it would be best to stay at home? Honestly, how long do we think this is going to last? Our recommendation to all of you, if you don't need to go out, stay at home. We are not under any type of order at this point from the state or the county to stay at home. However, we're trying to encourage that social distancing. We're trying to encourage you to stay at home as much as possible. And I think that that's reflective in the county's orders, the governor's orders to close certain types of businesses, to close certain areas, to help prevent that spread of this virus. So the answer to that question is yes. I think if you don't need to go out, you absolutely should stay at home. You should keep travel for essential travel only, and make sure that you're keeping that social distancing. And a question: why is the golf course closed? That's the same token. The county issued an order that non-essential businesses were to close, and that did include recreational facilities. Dr. Antevi, a question here: if you can be more specific about the different blood types and where you could find that information. You had mentioned earlier that perhaps certain blood types might be more resistant, and I know that this virus is still, kind of being studied, and we're learning more and more about it. Can you provide us a bit more information on that, please?
Sure. All of these new advances that I'm researching and looking at, I put on my Twitter account, so you can search for me for Peter Antevi, and you'll find me on Twitter. But that study from China showed that people with an A blood type were more prone to getting ill from coronavirus than those with any other blood type, and people with O blood type had significantly less chance of getting sick compared to the typical population of the breakdown of AB, and O in the community. So they looked at what's the typical rate of those blood types in the community, and then they compared it to the blood types that were getting sick. Again, correlation does not suggest causation. I want to warn everyone against that. It's just another one of those things, just like the ibuprofen. People are trying to figure out, is there some connection with something else? Now we know there's no kind of smoking gun here that if you have a certain blood type versus the other, that's just the data that's coming out. So look at my Twitter feed. I posted the article in full, and I posted some graphics from there that you may be able to decipher if you're in the medical field, but it should be pretty clear.
Thank you, Doctor. And, here at the city, we really believe that communication is key. So we appreciate you sharing that information. We're trying to share information with our residents as soon as it becomes available to us. A couple questions here about people that are still working in restaurants. What about them? Are they still, what's the deal with that? So just wanted to clarify that our restaurants are still open for takeout and delivery service. A combination of our emergency order here at the city, an order from the governor, as well as the county's order prohibits them from operating dining rooms. It also prohibits them from having any on-site food service. So those restaurants and businesses are still open for takeout and delivery service only as we continue to work through this order. Dr. Antevi, question here, and your blood type conversation is spurring a lot of comments from our viewers. If someone is O blood and wants to donate blood, they don't show symptoms, but they've traveled on a cruise in the past month, what would you advise them to do?
That's a good question. Remember, this is not a virus that you have to remember that when you go to the One Blood and you go to the van, like I always do, they're going to check you. They're going to ask you if you're symptomatic. Obviously, they always want to kind of check on the risk for anyone giving blood. So they will check the blood for many different types of viruses and so forth. I'm sure, and I have to verify this, whether they're even checking for COVID-19. But I will tell you that the blood bank is very short, and they're asking for people to donate blood. I don't care what kind of blood type you are. The blood bank is still asking to donate, but there's a caveat to that, is that you're not going to go out and expose yourself to other people who are in the medical profession. And so, it's one of those things where I frequently donate blood. I take my children with me so they can see dad giving blood. But I will say that during this time, it's something that I would see as another risk to yourself. So I know it's not a solid answer because I do love donating blood, and as a physician for 20 years, we've used people's blood to save lives. So not an easy answer at this time of the crisis, but I'll get back on the next FaceTime Live. I'll get back to you. I have very strong connections at the blood bank to see whether and how they're testing for COVID, if they are at all. Good question.
Thank you, Doctor. A couple questions here. How long will all the businesses be closed? The governor's order lasted for 30 days, so that order went out last week, so we can see that for the next 20 or so days. Question here, do we have more ventilators and PPE coming into Carl Springs soon? The shorter answer for that is yes. The state has been working, and we've seen the governor in his press conferences discuss the different measures FDEM, the Florida Division of Emergency Management, has taken to get additional PPE and ventilators into our state. However, the long answer is that this is a international crisis. This is shortages of PPE and ventilators, not just here in Carl Springs, but around the state and around the globe. So that is something else to keep in mind. Dr. Antevi, a question for you. Children aged 2 to 10 with asthma, are they more at risk if they do, in fact, contract COVID-19?
Yeah, just like we mentioned in the last Facebook Lives, anytime you have an illness that's with you, and one of my kids is asthmatic, and so I am a little bit more worried about my son getting COVID-19 than the others, and so just like any other upper respiratory illness could affect an asthmatic more so than someone who does not have asthma, I would say yes, children with asthma are more at risk, just like they'd be at higher risk if they got the flu. So the answer is yes to that.
Thank you. And a question here for prevention. What's the best way to keep this virus from spreading? You know, if you have a member of your household that has to leave to keep going to work, what's the best method of preventing them from spreading it when they come back home?
Yeah, I can tell you that many of us in the medical field have that exact problem, right? Where we're working in the emergency departments, we're seeing very sick patients every single day, and our spouses are very nervous, and rightfully so. So I would say, and we've actually put policies in at our hospital for people to bring a change of clothes, change out of those clothes before they even leave the hospital. That's never been done before, to be quite honest with you. In the fire department, we're having people shower, change their clothes, if there's even a simple exposure to that. If you do those things and you cover yourself correctly at work, and you come home and you take off all the clothes beforehand, change into a new set of clothes, shower when you get home, keep your hands washed, then I think you're in good shape. I would also say, Alex, that, and we've been doing this here, we've been ordering all of our groceries to come to the door. And my wife is even taking the extra step of kind of cleaning out the outsides of things because other people have touched those things, and we don't want to bring that into the household. So this thing is sneaky. You don't have to have a person in front of you to get it, because things are being delivered to your door that could theoretically have it on. And anytime I go out and I'm in front of somebody, I wear my mask, and I have a glove on. I have gloves on, and it's because I'm in healthcare and I don't want to give it to anybody else if I don't have to. But trying to stay home if I can at all costs.
Thank you, Doctor. And a couple questions here. Diaz mentioned that people are breaking into the parks around her house. If you see people that are not adhering to the emergency orders or breaking into certain areas, please call our police department. If it's an emergency, of course, dial 911. If it's a non-emergency, 954-344-1800. And just as always, report any suspicious activity that you do see in the community. A question here from Amy about why are construction sites still open? Under the county's closure of non-essential businesses, construction sites were not included, so construction projects were allowed to continue. Dr. Antebi, I'd like to talk a little bit about testing sites and some testing locations. So we know we have a couple testing locations, one at CB Smith Park, one at Broward Health Pompano, and one at Cleveland Clinic Weston. Can you talk a little bit about the testing sites, talk a little bit about why the test results are taking so long to come back, and any recommendations if folks are sick, maybe they have mild symptoms, should they go get tested or should they treat the symptoms at home?
Great, Alex. These are all great questions. The bottleneck of the testing is in the number of labs initially that were performing the test, right? Initially, they were just kind of the state labs. And then the other bottleneck are the reagents, the chemicals that are needed to actually run the test. So we've moved now beyond just the state running the test into now Quest, LabCorp, these sites that Alex just mentioned, hospitals who are now able to run their own tests. And so I know other hospitals are coming on board, but the hospital I work at Memorial Regional, we have the ability to run our own tests, and therefore we can get the test back rather quickly, right? And so the other tests, the other sites, the main question is, where are they running the tests? Because believe it or not, sometimes those tests are being shipped by either FedEx, or they're being shipped by air somehow to a testing center, to a lab, and therefore they're taking days to come back. And this could be, we've experienced 4 up to 6 days. It's not acceptable for many people, especially those who are sitting in a hospital who are ill. Now I will tell you that there's the other side of the coin, which is saying that if you're really sick, then we're going to treat you either way as if you had the virus even before we know the result, and that is true. Should people now go out and just go to those sites and get tested? I would say that as the number of tests start to ramp up, as different tests start to come in that are more point of care, easier to do, We need to reserve those tests for the people who have symptoms, for the people who have an exposure to somebody with COVID-19, basically following the CDC guidelines for who needs to get tested. Once the number of tests we have and the ability to run different tests are more available to us, then I see a future where anyone and everyone will be able to get a test. And a lot of people are going to want to know, was I ever exposed and can I go back to work? Was I never exposed, or am I actively infected? And so I think that we're not at that point yet. I'm looking forward to the day that we are, but I would ask everybody, even people who are working in local city government or in the fire department, we're not randomly testing everybody. We're testing the people who had an exposure and who are showing symptoms. So I really want to enforce that this is evolving, it's going to change, but please be respectful that there are people who need those tests now, and not everyone fits that category.
Thank you. And we just got a response back from our poll. So I'd like to thank 97% of you who said that you are staying home, that you're doing the right thing. That's exactly what we need to do right now. A couple of other updates that I'd like to share. Our mayor has called an emergency commission meeting for tomorrow at 5 p.m. That commission meeting is going to be available on City TV. It'll also be live streamed to our website. We're working on, virtual meetings, just like you and I are Skyping here from different locations. We're trying to work on virtual meetings, which the state approves, so that we can continue to connect with our residents. We can continue to host these meetings in a manner that's not going to lead to further spread of this. With that, I had one more question for you here. We're getting reports that more young people are getting COVID-19, and why. Can you talk a little bit about that number and a little bit about whether or not we're seeing a lot more getting it, or we're just getting more test results back, or kind of what the underlying theme is there?
Right. So, I think that everyone is at risk of contracting the illness. We know that, and they're predicting upwards of 100 million or more Americans will get COVID-19 at some point within the next year. What we're asking here is how many of those people will get hospitalized, will get critically ill, and then unfortunately how many of those will die. And so we do have data, and I'm looking at it on my screen here as we're speaking. And Alex, this is data from the United States of all the cases, and all the cases broken down by age group, and broken down by who was hospitalized, who went to the ICU, and then who died. And this could all be found on the CDC's website. And essentially, as I'm looking at it here, in the 0 to 19-year-old age group, very few hospitalizations, no ICU admissions, and no deaths. That's under the age of, that's 19 and under. Once you start getting into the 20 and above, the hospitalizations are staying pretty consistent. The ICU admissions are lowest in the 20 to 44-year-old. They go up in the 45 to 54. They're just as high in 55, 64. They go higher in the 65 to 74-year-olds. So the 20 to 44-year-olds are still affected hospitalization-wise. They're still affected a little lower, but ICU admission-wise. They have the fewest deaths. And so here, as I'm looking at the screen, in America today, the highest number of hospitalizations is the 65 to 74-year-old age cohort. Number of ICU admissions is higher in the 65 to 74-year-olds, I'm sorry. And then the number of deaths in that age range is the highest. And so, yes, you could get sick. Yes, you could go to the hospital. Yes, you could go into the ICU if you're 20 and above. But as I mentioned, there's certain age groups that are higher than the others. But 19 and under, they look pretty good. But that doesn't mean that they can go out and party on the beach like they were doing, because they're just spreading it to people like us who may get it and may get very sick from it. And then I'll end on that, but I do want to mention, as we were talking here, I did go onto the Red Cross's website, and they are going to be screening you for symptoms. They're still begging for donations. They're not testing for the disease in the blood, it's saying here, but they are desperate for blood. And so it's one of these high wire acts where you have to balance between needing blood for trauma victims and people who are bleeding out, pregnant women and so forth, versus having someone give blood who's at risk of having COVID-19. So there is a screening plan in place for when you give blood. They will ask about the COVID-19 questions.
Thank you, Doctor. So with that, we would like to wrap up our question and answer session tonight. We encourage our residents to continue visiting our city's website, www.carlsprings.org. We'd encourage our residents to continue following us on social media. Likely much will change before we have another question and answer. This is a very fluid situation. We're getting updates daily, and we will share those with you as soon as that information becomes available to the city. So with that, I'd like to thank everyone for tuning in. I'd like to once again thank all 97% of you that are staying at home and encourage you to continue that social distancing and continue to help us prevent this spread. Thank you so much and have a good night.
Thanks, everyone.